All right, get ready for a real deep dive. Today, we're tackling canine neuromuscular neosporosis.
Yeah, NNN, as we like to call it.
Oh, you're going with NNN.
Well, we can't be saying neuromuscular neosporosis all day, can we?
Fair enough.
Yeah.
But yeah, it can be a tough one for vets to diagnose, right? Looks like a million other things.
Absolutely. It can mimic so many other conditions and often doesn't show up until dogs are older, which makes it even trickier.
It's not just a puppy problem then.
Nope, not at all. We're talking dogs of all ages struggling with muscle weakness, trouble walking, even paralysis in severe cases. Really heartbreaking to see.
Oh, absolutely. So we've got this study, right? And they dove deep into a whole bunch of diagnostic tests to try and get some clearer answers.
Yeah, they weren't messing around. They used a whole range of tests. Blood work, spinal fluid analysis, electromyography, MRI, even biopsies. Talk about bringing in the big guns.
It's like CSI for canines. So where do they even begin with something like this?
Well, it often starts with those classic signs: difficulty walking, muscle weakness, maybe even some pain. Owners might notice their dog is a bit wobbly, reluctant to jump, or maybe even dragging a paw.
Subtle signs, easy to miss.
Exactly. And that's why it's so important for owners to be observant and know their dog's normal behavior. Any significant changes, it's time for a trip to the vet.
Makes sense. So the dog comes in with these vague symptoms. What happens at the vet visit? What are they looking at first?
Well, the vet will do a thorough physical exam, of course, checking for any muscle loss, weakness, or changes in reflexes. But to really get to the bottom of it, they need to run some tests.
Okay, so cue the blood work montage. What are they looking for in those vials of precious doggy juice?
One thing they're checking for is elevated muscle enzyme levels, particularly something called creatine kinase. If those levels are high, it's a sign of muscle damage.
Like a flashing red light saying, hey, something's wrong here.
Precisely. But high muscle enzymes alone don't scream neosporosis. It could be a whole bunch of things. That's where the multimodal approach comes in. They used a combination of tests to get a more definitive diagnosis, which is really what this whole deep dive is about.
Right, like putting together a puzzle. So if the blood work raises those eyebrows, but it's not a slam dunk, what's the next step in this investigation?
Well, they might do a cerebrospinal fluid analysis. That's where they take a sample of the fluid that surrounds the brain and spinal cord to see if there's any inflammation there.
Whoa, hold on. Tapping into the spinal cord. That sounds incredibly delicate.
It is a specialized procedure, but it can be really important in cases like this.
And what about those biopsies you mentioned earlier? It sounds like we're getting to the really hardcore stuff now.
You could say that. They're taking tiny samples of muscle tissue to examine under a microscope.
Okay, zoom way in. What are they hoping to see at that microscopic level?
They're looking for signs of the parasite itself, of course, but also for any damage or inflammation in the muscle fibers. And they've got some pretty high-tech ways of doing that these days.
Yeah, spill the tea. What kind of fancy technology are we talking about here?
Well, one technique they used is called immunohistochemistry, or IHC for short.
Okay, I'm already lost. Break that down for me.
Imagine this. They're basically using special dyes that stick to the parasite, making it light up under the microscope. It's like highlighting the culprit in a lineup.
Ah, so they can actually see the little buggers? That's pretty cool.
Yeah, it's pretty amazing. They also use a technique called in situ hybridization, which is even more specific. It actually targets the parasite's DNA, like a microscopic GPS.
So they're not just looking for a guy who looks suspicious. They're checking his fingerprints.
You got it. They want to be absolutely sure they've found the right culprit.
Makes sense. They don't want to wrongly accuse a stray muscle cell, right? So each of these tests is like adding another piece to the puzzle, building that case for neosporosis.
Exactly. It's all about getting the most complete picture possible.
That's a key question, though. Why go through all this trouble? Why is this multi-pronged approach so important when it comes to neosporosis?
Well, for one, it can look like a lot of other conditions, so you have to rule those out. And two, because the sooner you get that accurate diagnosis, the sooner you can start treatment, and that can make a world of difference for the dog's outcome. But we're getting ahead of ourselves. Let's dive into those 16 cases in the study and see what they can teach us. So we've got the 16 dogs, right? All different breeds, ages, you name it. But they all had one thing in common: a diagnosis of neuromuscular neosporosis.
A real mixed bag of pups facing this neurological challenge. And you mentioned earlier that neosporosis can hit dogs of all ages, not just the youngsters. This study really drives that point home, doesn't it?
It does. They had dogs as young as 2 months old, all the way up to a 10-year-old senior dog. Really busts that myth that it's a purely pediatric condition.
Wow. 10 years old. That's heartbreaking. I can only imagine how tough it must be for those senior pups to deal with this on top of everything else that comes with age.
Absolutely. And the symptoms, they varied quite a bit too. Some dogs were just a little wobbly, while others were completely paralyzed. It's a real spectrum.
That makes sense given that neosporosis affects the muscles and nerves. Those are pretty essential for, just about everything a dog does.
Exactly. The most common finding in this study was what we call generalized neuromuscular involvement. Basically, it means those poor pups were dealing with widespread muscle weakness and difficulty controlling their movements. Think about how frustrating that would be, wanting to run and play, but not having the strength or coordination.
It's like their body just isn't cooperating with their playful spirit. Must be incredibly frustrating for both the dog and their worried humans. So, we're talking muscle weakness, difficulty walking. What other kinds of symptoms might owners notice in their dogs if neosporosis is the culprit?
Well, some dogs might be a bit more lethargic than usual, maybe not as eager to go for walks or play fetch. You might even see some muscle tremors or twitching, especially in those more severe cases.
So, a whole range of clues, from subtle shifts in energy levels to more obvious mobility issues. But those early signs, they could easily be mistaken for something else, right? Like just an off day or maybe even just getting older.
Exactly. That's why it's so crucial for owners to know their dog's baseline behavior and to speak up if they notice any changes, no matter how small they might seem. Early detection is key here, folks.
Okay, so let's say the owner does notice something's not quite right and they take their furry friend to the vet. We talked about those diagnostic tests earlier, but let's break those down a little further, shall we? Paint a clearer picture of what's actually involved in diagnosing neosporosis.
Absolutely. So remember how we talked about those elevated muscle enzyme levels? That's often one of the first clues. They'll take a blood sample and look for signs of muscle damage.
Right, like those creatine kinase levels you mentioned. It's like a biochemical smoke signal saying, hey, pay attention to those muscles.
Precisely. But like we said before, elevated muscle enzymes alone don't tell the whole story. It could be a muscle strain, an injury, heck, even just really strenuous exercise. That's where those other tests come in to help narrow things down.
Right, we need more pieces to this diagnostic puzzle. What about that spinal tap or cerebrospinal fluid analysis? What's the thought process behind that one?
Well, with neosporosis, sometimes the infection can spread beyond the muscles and into the central nervous system, that's the brain and spinal cord. So by analyzing the fluid that bathes the central nervous system, vets can look for signs of inflammation or infection there.
Okay, so they're looking for those telltale footprints of the parasite, but this time in the central nervous system. But that procedure, it sounds a little intimidating, to be honest.
It's definitely not your average walk in the park, but it's a really valuable tool for diagnosing a whole range of neurological conditions in dogs.
And it helps to explain why it's so important to have these cases seen by specialists who have the experience and expertise to perform these procedures safely and accurately.
Absolutely. And then, of course, we have the biopsies. That's where things get really interesting from a diagnostic perspective. Remember those high-tech techniques we talked about earlier?
Oh, yeah, the ones that sound like they came straight out of a sci-fi movie.
Well, with these biopsies, they're not just looking at the muscle tissue under a regular microscope. They're using these advanced techniques to identify the parasite with incredible precision. It's like having a microscopic detective on the case.
Okay, I'm all ears. Give me the rundown of these high-tech detective methods.
So one technique they use is called immunohistochemistry. Basically, they use special antibodies that are designed to bind specifically to the Neospora parasite. These antibodies are linked to a fluorescent dye that lights up under a special microscope.
Wait, so they're basically tagging the parasite with a glow stick?
Pretty much. It allows them to see exactly where the parasite is located within the muscle tissue.
That's amazing. So it's not just about finding evidence of muscle damage. They're actually able to visualize the parasite itself.
Exactly. And then there's in situ hybridization, which is even cooler. This technique targets the parasite's genetic material, its DNA.
Okay, so now we're talking DNA analysis,
Yes.
CSI level stuff. How does that work?
They use a special probe, which is a tiny piece of DNA that's designed to be a perfect match for the parasite's DNA. This probe is also tagged with a marker, like a little flag, that allows them to see it under the microscope.
So it's like sending in a guided missile to home in on that parasite's DNA.
Exactly. And if they see that probe lighting up under the microscope, they know for certain that the parasite's DNA is present in the tissue sample. That's pretty much a slam dunk when it comes to diagnosis.
It's like getting that DNA match and knowing you've found your culprit. So they've got all this evidence from the blood work, the spinal fluid analysis, and now these high-tech biopsies. It's like building an ironclad case, piece by piece. But at the end of the day, it all comes down to those individual dogs and what this diagnosis means for their future, right?
Absolutely. And that's what we're going to delve into next. The outcomes for these 16 dogs, the treatments they received, and what factors might influence their prognosis. And spoiler alert, there is some good news here. So remember how we talked about those different forms of neosporosis? Well, it turns out that dogs with the neuromuscular form, the ones where the infection hasn't spread to the central nervous system, they actually have a pretty good prognosis.
That's a relief to hear. So early detection is key here, right? The sooner they can catch it, the better the chances of a full recovery.
Exactly. In this study, 7 out of the 16 dogs had that neuromuscular form, and they all made a full recovery with treatment.
That's amazing. 7 dogs back to chasing squirrels and napping in sunbeams.
Right.
What kind of treatment did they receive?
It was a combination of things: antibiotics to target the parasite itself and anti-inflammatories to help manage those painful, swollen muscles.
Okay, so a two-pronged approach to tackle both the infection and those uncomfortable symptoms. That makes sense. But what about those other dogs? The ones where the infection had spread to the central nervous system? Those cases always seem so much more, well, daunting.
It's true. Central nervous system involvement definitely complicates things. Unfortunately, for those dogs in the study, the outcomes were much more variable.
Meaning some didn't respond as well to the treatment.
Yeah, some dogs showed some improvement with the medications, but others unfortunately didn't. And sadly, in some of those severe cases, euthanasia was the most humane option.
That's always so tough. Those heartbreaking decisions that families and vets have to make together. It really highlights just how serious this disease can be and the importance of early detection and treatment. But realistically, how do you even begin to prevent neosporosis in the first place?
Well, that's the million-dollar question, isn't it? It's not always easy, but understanding how dogs get infected is a good starting point.
Okay, so back to basics. How do those pesky neospore parasites actually make their way into our canine companions?
Well, contrary to popular belief, it's not just about sniffing poop. While dogs can pick up the parasite from contaminated environments, the most common route of infection is actually through ingesting infected tissue.
Ingesting, you mean like eating? Eating what exactly?
Think rodents, birds, other small animals that might be carrying the parasite. Dogs who have a bit of a taste for wildlife are definitely at higher risk.
So those city slicko pups who stick to kibble and the occasional dropped bagel are probably off the hook.
Well, not entirely. Remember those pregnant dogs we talked about earlier? Those moms-to-be can actually pass the infection on to their puppies in the womb.
Oh, right, even before they're born. That's heartbreaking.
It is. That's why it's so important for breeders to have their dogs tested, ideally before breeding, to help break that cycle of transmission.
Okay, so we've got wildlife snacking, we've got mother-to-puppy transmission. Any other risk factors that owners should be aware of?
Well, dogs with weakened immune systems might be more susceptible to infection, and those living in areas with high concentrations of wildlife are obviously at higher risk too.
So what can we do, besides locking our dogs in bubble wrap and never letting them outside again?
Right, well, we don't want to go to extremes. Simple things like good hygiene, picking up after your dog, regularly cleaning up their living areas, that can go a long way. And for those adventurous pups who love to explore, leash training is crucial. Keeps them out of trouble and away from potentially infected critters.
Makes sense. Leash training, the unsung hero of canine health. But at the end of the day, it seems like early detection is key here, right?
Absolutely. Regular vet checkups, being attuned to any changes in your dog's behavior or mobility, those are your best bets for catching it early when treatment is most effective.
So true. Those early signs might be subtle, but they could make all the difference. Wow, we really covered a lot of ground in this deep dive. From those first subtle signs of muscle weakness to those high-tech biopsies, all the way to prevention strategies. It's amazing how much there is to learn about these complex neurological conditions.
It really is a testament to the incredible work that veterinary specialists are doing every day to diagnose and treat these challenging cases.
Absolutely. And to all those worried pet parents out there, remember, knowledge is power. The more you know about conditions like neosporosis, the better equipped you are to advocate for your furry friends. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.